This video looks at the most helpful remedies for treating painful fibroids. Will you have to rely on drugs, or will you get better relief from surgery? Also, what benefits can CBD products have on fibroid pain relief, and is it actually worth trying? Hi, I'm Dr. Sylvia, a GP and health educator with AskAwayHealth. We talk about health issues on this channel, helping you learn more about your bodies and live better. Please like this video and subscribe to the channel, and don't forget to click the notification bell so hopefully you get an alert every time we publish a new video. Fibroids are benign growths of the womb tissue, and commonly they affect 1 in 3 women around the world. In a lot of cases, fibroids can exist without causing any symptoms, but often they do cause a lot of problems, especially pain. Pain from fibroids tends to happen in the form of chronic or long-lasting, repeated pelvic and abdominal or tummy pain, including pain every day that can be mild, moderate, or quite severe. From fibroids, you can have pain during sex. You could also have pain passing urine or when opening your bowels. You could get painful menstrual periods and experience leg or back pain when you have fibroids pressing against nerves or that have grown so large they are pushing against other organs inside the abdomen or pelvis. So, in the presence of the persistent discomfort that fibroid pain can cause, what are your options for getting relief? The choice of treatment of fibroids depends on issues that can be different from one woman to the next. And apart from the most obvious reasons like control of symptoms, it can also depend on the woman's age and her own personal choice or preference. In a small number of women, fibroids can also lead to infertility, so whether or not a woman still wants to have children can be a factor in her choice of treatment. In such cases, you may want to opt for surgery, but again, the choice might also depend on the position and the size of the fibroids. Some women fall into the category where the fibroids do not really affect their pregnancy chances, or they don't want to have any more kids. And so, if the main issue is about controlling pain or heavy bleeding, it's good to know what other options are available to treat it. So let's start with hormones. Some women who have mild or moderate pain with their fibroids or have pain around their periods or from time to time may get relief from simple pain relievers. And these include drugs like paracetamol, ibuprofen or naproxen. A heating pad, hot water bottle or warm compress during periods can also help relieve the pain if it's not very severe. But these methods may not be enough or may not suit everyone, so we should have options. Hormones that have been found useful in controlling pain from fibroids include the combined contraceptive pill. This contains both estrogen and progesterone. The combined birth control pill can lighten heavy bleeding periods, which in some cases can lead to less painful periods. Other hormone birth control methods that are helpful for painful fibroids is the progesterone IUD or intrauterine device or coil, which contains progesterone. And there is another group of hormones which are not contraceptive but can help with symptoms like pain. These hormones can help to control symptoms temporarily by shrinking the size of the fibroid. And these drugs are GnRH agonists and antagonists and are often used before fibroid surgery to make the fibroid smaller and easier to operate on. Now, if you want to learn more about these drug treatment options, make sure you check out my video here. But what if none of these hormones is suitable for you? For example, you may have side effects or just don't want to use them. Does that mean you must settle for fibroid surgery? Well, not necessarily. Yes, fibroid surgery, whether it's the removal of the fibroid, that is a myomectomy, or the removal of the entire womb, may be an option for some women. But non-surgical options are available. But before I mention them, what do you think about acupuncture? Acupuncture is based on traditional medicine and is a form of complementary medicine where needles are placed on your skin to trigger a response in different parts of the body. When it comes to complementary medicine, many times we don't have too many studies on how well these studies work. But acupuncture has been used for many years to treat different conditions, including women's health problems like painful and heavy periods. It may be helpful in some women who suffer from these conditions. So if you have access to a registered acupuncturist near you, might be an option that you want to consider. And now for the non-surgical options. Uterine artery embolization is what happens when specially trained doctors inject materials into blood vessels that can cut off the oxygen supply to the fibroid, causing them to die. And you can learn more about uterine artery embolization or uterine fibroid embolization by watching my videos here and here. In addition, some fibroid treatment centers can use laser or electric therapy to shrink the fibroids, or apply ice treatments to achieve the same goal. And now, what about CBD products for fibroids? Can they help with pain control? Some women have found using CBD oil suppositories helpful to treat painful fibroids. CBD oil products are thought to have anti-inflammatory properties, so while they may not necessarily heal or cure the fibroids, they may be able to control some of the symptoms like pain. In addition, adopting a healthy lifestyle based on less red meat, cutting out alcohol, losing weight can improve your overall health and improve your symptom experience with fibroids. In my video on natural options for fibroids, I talk about diet choices like plant-based and high-fiber foods such as whole wheat bread, whole grain, seeds, mineral supplements, castor oil treatments, and more that can provide some support in managing painful fibroid symptoms. That's this topic done and dusted. Thank you for watching. Hopefully this video gives you a perspective on the range of treatments that can be helpful for painful fibroids. Please discuss each method with your doctor if you want to consider using them. Remember that even natural methods can have different side effects or even interact with other medicines that you're taking. If you want to send me a question on this subject, please use our email service for fast responses straight to your mailbox. Next time, we'll be looking at birth control options for a special group of ladies aged 40 and above. So please like this video, and if you want to watch the next, make sure you've subscribed and click the notification bell so that you know when that goes live. And while you're waiting for that video, check out these two here, and I'll see you again soon.